Okay, good evening, everyone. Hope you're staying warm. It looks like the agenda came different from the packet. Okay, yeah, I found the agenda. Okay, I would like to call to order this Board of Health monthly meeting for Wednesday, January 14th. Amy, could you call the roll, please?
Danielle Chenoweth.
Present.
Jennifer Luck.
Present.
Okay. I would take a motion for approval of the agenda.
So moved.
A motion, I'll second that. Discussion, any additions? All those in favor say aye.
Aye.
Opposed, that carries. Next we have approval of minutes of the previous meeting for December 10th, 2025, monthly meeting. I'll entertain a motion.
So moved.
A second, all those in favor? Aye. Opposed, that carries. Next we have time of public participation. Is there anyone here who would like to speak to the public? Go ahead.
Thank you. My name is Pius Weibel. I'm a dual citizen of Urbana and Champaign. I'm here and I feel it's appropriate that I can bookcase the beginning, but not at the end, but I love the beginning of present administrators regime here, if you want to call that. In an interview earlier this week, you mentioned that you were sort of accidentally became the director, and that's an apt description. The events that led to that were surprising and bizarre. Perhaps the current board would consider opening up the closed minutes of that time period so that people could see how bizarre they were. Certainly have legal goes through first. But it was a pleasure working with Julie. I worked with you probably about a little over 7 years as a member of the board. And then we did lots of stuff, training for all sorts of epidemics. Nothing happened at the time, but we certainly were trying for it. It gave me faith that this health district was prepared for it. I'm glad we did that. It was a pleasure working with her, and I think there was no question that even though she was accidentally appointed, it was the best decision at the time, and I have no regrets of it.
Well, thank you. Thank you. So you heard that, the accidental administrator.
There was. The best ones are. Any other input from the public? Seeing none, we'll move on to correspondence. I just, I've been giving very brief updates on the shelter. I'd like to, I'm preparing data about the Armory shelter and Strides together so that the board and the public, I'll be speaking to the, whatever it's called, the MIC, Metropolitan
Intergovernmental Council.
Thank you. I'll be speaking at the Metropolitan Intergovernmental Council on February 11th with Charlene. So the two townships will hold hands and will present on the state of Liberty Shelter and Emergency Shelter. I did just want to give like 5 data points on our armory because I think it's very interesting. I was going to waiting this till we had a pool, like a data pool that was large enough. So we have had we've had 104 individuals spend at least one night in Pee-wee's, our public winter emergency shelter, since its opening November 25th, 2025. We're seeing a regular 45 to 65 men a night. When it's real cold, it's 65. When it's less cold, it's 45. Actually, I don't think we've had 45 for a while. They get a light dinner and hot breakfast and coffee. Thanksgiving and Christmas, people were provided meals. Anytime, it's an 8 to 8 shelter, 8 p.m. to 8 a.m., just because that's what we had funding for. But if it is 20 degrees or below or any severe weather, folks stay indoors, so they will be in through Wednesday. Public Health basically owns the cots and the bedding, the refrigerator and freezers, no, not the microwaves, I don't know, whatever you give us, those are the things. Mom and Dee was very instrumental in helping get the items and make sure we had adequate blankets, etc. We have space in terms of cots and things for about 100 plus. We haven't needed that, which is what was expected. I expected about 75 at its height based on the numbers that we had. We have on-site laundry that is about to go live here this week. We've been doing service referrals. So I just wanted to share a little bit of data because I think that that has been missing from the conversation about emergency and low barrier shelter. So of that 104, 28% of the men are 55 and up. They range from 17 to 72 with an average age of 45 years old. And I'll send this to you as well, send the supervisor's memo. I'll get to the 17-year-old in a minute. We don't usually have youth in our space. 61% had listed disabling condition that keeps them from working. That's almost 2/3. 45 men stated an actual permanent disability status. And about 2/3 have Medicaid and about 1/3 don't. 39% report some form of income. 13 report earned income, and then you have 19 have disability. So that's 14 men earned income, 19 with disability, 3 with retirement, and 4 with general assistance. And 2 are reporting being a veteran. So that's interesting. I have a lot more data, but that's like the top ones I thought would be useful. We have 4 men in wheelchairs. We are seeing almost 2/3 have a disabling condition, and over a quarter are seniors. So that's significant, and it's based on what we're seeing. And I think our numbers are probably going to be very similar to Strides, but we're going to find out. We have no RSOs, no registered sex offenders at this location. Interestingly, the story that I hear time and again is if you build it, they will come. And I think that money is not the reason we don't have a sufficient low barrier shelter. It is that story. So we have been collecting, and I know we talked about this at the beginning. We asked, how long have you been in Champaign County and what brought you here? That's very simple, and everyone gets asked that question. And we have kind of categories, so you check off like under a month, 1 to 3 months, 4 to 6 months, blah, blah, it goes up. So we really fine-grained to ask that question. Interestingly, 62% or 65 men have been in Champaign County 2+ years. And 48 of the men have 10+ years of residency. If you look at 4 months to 2 years, which is before we opened shelter, that's another 14%. So you add those together and you get basically 76%. Like 3/4 of the entire population were here at least 4 months and longer, and really looking at that longevity of 2 years and longer, or even 10 years and longer. So we did have 25 men arrive in Champaign County between 0 and 3 months. I noted that with that when we opened the shelter, Restoration Urban Ministries came to me. There was a case manager who said, wow, I wish I had known you were opening a shelter. I just placed 26 people outside of the county who I could not find housing for. So interestingly, they are obviously not the folks who came back, but I think that the story really is that homeless residents, and this is my hypothesis, which I'd like to pursue with data, it's a hypothesis, that the homeless population is an internal or domestic refugee population. It's constantly being moved around, looking for resources, etc. And I think we'll find if we're going to count entrances, we have to also count exits out of the community, right? It's both. It's a net situation. So of the 25 who arrived in Champaign County in that 0 to 3 months, 2 came for employment, 5 came for family in the area, stayed with the family and got kicked out. 4 were stranded, and that was the only reason. 3 came for hospital services. They were then also stranded. 1 for court, also stranded. So 4 just listed, I'm stranded, I was dropped off. So we had actually a total of 8 who really were stranded. 1 was fleeing domestic violence. Only 2 of the 25 men said I came here because of the shelter. And 3 said I need a change. So that's just, I report what they say. 3 were dropped off by DCFS caseworkers, ages 17, 18, and 19, 2 from St. Louis, 1 from Deerfield, Illinois. And we called and we said, do not have them come here. They are youth in care. You should be working with Cunningham Children's Home, and they brought them anyway. So they got an earful from us. One of the youth, from Deerfield, we were able to provide appropriate replacement. In no cases are we shipping people off to nowhere. So if they're here and they're in our care. The 17-year-old was our priority, so we were able to, because we don't serve minors, so we were able to get that person into more appropriate placement. So, so I'm talking with Strides, and it sounds like this and police from out-of-town drop-offs is not an all-the-time thing, but it is an occasional problem that is happening. So, and then I looked at the 28 here less than a year, right? And 10 have exited the shelter, and only 1 appears to have stayed locally. So really, we are seeing people who are stranded here. They don't have any place to stay, they don't have income. We're giving them a place to stay for a few nights. And we are offering anyone who wants reunification, as long as we can confirm the person will receive them. So we call, we make sure they have a safe place to be received. We will then provide a bus ticket, because they don't want to be here, they just got stranded. And so we're not forcing anyone out. But I just wanted to share that data. I will share the supervisor's memo with you all. I found it really interesting, and I will see, I'm met with Strides to start pulling their data, and I'm hoping we will have a full report for the 11th, February 11th presentation. Is CUPHD part of that? The municipal MIC?
You mean, are we a member?
Yes.
Yeah,
Okay.
Mama will be at that one.
Okay, good. So we'll be presenting there, and then I can also present to the board. So I just wanted to share, since CUPHD has been an important part of the shelter, what it has looked like. I also want to mention that there's been now, since we've had 2 permanent bans due to physical altercations, 0 complaints made by the community, and we actually had an Amazon with delivery to across the street, like literally across the street from the main entrance where the guys come in, and the delivery went to them instead of us. And so we went over and said, hey, we're so sorry, that belongs at the shelter. And they're like, what shelter? So I think we've done pretty well in that regards. I will say that the gas bill is $4,500 a month, and that is freaking me out, but that is not what I anticipated based on my calculations. But other than that, everything's pretty good. The city of Urbana has pledged $37,000 in staffing for daytime. That amounts to about 1,400 person hours. So we are currently exploring adding time in the morning for case management. So folks get up and have breakfast, and then they can meet with their case manager. We're also exploring, because Strides can't accommodate 60 people, and that's where we're at, in their day center. So it's been very cramped, and is to actually just go to having people screen at our office and then go there and open earlier. So stay tuned, that's where we're at, but that funding will help with that piece. I'm happy to answer any questions about it.
Well, I just want to say that the hospitals need to come up with a better way when they have people that get stranded here, that they can come up with a solution for this without causing it to escalate into a potentially much more difficult problem. So I really want to encourage, continue working with the hospitals to make sure that they are doing discharge planning, even if somebody's in the ER, and they know if somebody has issues going on with them. I mean, we've seen, sick people with dementia put out in the snow in sub-zero temperatures. That's got to be, we've got to keep calling that out. That's unacceptable. It's unacceptable.
Yeah,
And the police bringing people here too is also unacceptable.
I think leaving people out of the cold is I'm trying to figure out if it's illegal. I've talked to Lincoln at this point and continue discussing.
I would still suggest, I don't know all the issues with the one client that we initially talked about, but I do think that there needs to be something done to that county that brought the person up here. It would require us to have help from somebody to find, do a FOIA and get the information and find out what they did, because I 100% think that what they told me was not true based on.
No, it wasn't based on the timing of their call to us.
Yeah.
It was not.
No.
It was false information.
Yeah. And it would that phone call, talk about escalating quickly. It did. I actually pulled a muscle right here. But it was it was ridiculous, and what was happened, and what it is another county brought a person here.
Coles County, I'm just gonna name it was
Coles
Coles
County
County.
Sheriff's Office drove somebody up here, dropped him off at 11 at night, outside of the homeless shelter. It was an elderly
On the
person.
Sunday before Thanksgiving, she's 73 years old, she's a veteran, and she has dementia,
Yeah.
and she could have died if we didn't.
It was, when I got the call, it was -1
That's
hour.
right.
And so, they just dropped off outside. They deny all of that, and I'm like, well, we need to probably do that, and if not, if there's nothing that can be done with it, that at least needs to be public information. Their county needs to know what they're doing,
Mhm.
and, they need to, we need to be able to recoup that cost. I would think you would wanna get that money back.
Yes, we're continuing to pay for her hotels.
Yeah, so.
Yeah, so I look forward to working with the new administrator, and working with the healthcare, agencies. I will say CSPH is funded through Cunningham Township, CSPH being the Continuum of Service Providers of the Homeless, to do a strategic plan to end homelessness this year. And so we'll be engaging all the different municipalities, the county, RPC, the hospitals, mental health, law enforcement, et cetera, to put together a steering group and discuss these pieces. And we'll be having some like focus group and targeted groups, and around the mental health and healthcare piece will be a piece of that, so. I also wanna say the Community Health Partnership of Illinois, we have a standing MOU with them, and they are going to do an outreach event at the Armory on the 26th. And then we are looking to collaborate with Strides on their mobile unit providing care on site, essentially, or between the two shelters, so moving forward with
I
that.
think
too.
that their mobile unit is incapacitated. I think they're in the shop right now.
They say they have two.
I think they're, but the last I was just told that they're both in the shop, and one of them just had the entire top ripped off by going under an underpass.
Okay, so we'll see. I'll work with anyone who works with me. I have a meeting with Promise Healthcare set up as well, so.
Yeah.
Any other questions? Otherwise, I will stop taking up the oxygen of the room on this issue, but you will not have me stop talking about the homeless until we do not have homeless residents. Okay, next, new business, treasurer's report. Ron?
As of November 30th, 2025, we show cash on hand at $9,374,846. Our total fund balance was just over $8.5 million, representing 47% of the budgeted expenditures for the year. We ended the fiscal month with a deficit of $885,970. That's against a budgeted deficit of $295,100. We had total revenue of just over $6 million, which is $817,000 under the year-to-date budget, mainly due to grants and contracts being under the year-to-date budget by $651,000, fee for services under the year-to-date budget by $153,000. Our total expenditures, $6,980,000, which is $226,000 over the year-to-date budget. Personnel was under budget by $358,000, but the fringe benefits was over the year-to-date budget by $880,000, which is almost identical to where our deficit was, and that was mainly due to the funding of the pension that we approved last month. And so every month we go, that'll get less and less until it's probably not over budget by the end of the year.
Great, thank you, Ron. Any questions? I'd entertain a motion to put the treasurer's report on file. So moved. Second, any discussion? All those in favor say aye. 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 Opposed? Carries. Next, we have approval of payments to Board of Health appointees, Treasurer Ron Fields for December 2025 services. I'm going to take this in the omnibus motion, and Attorney Ruth Lyman for legal services from November 16, 2025 to December 15, 2025. I'd entertain a motion. So moved. A motion, I will second it. Any discussion? I will just point out that it, you can follow along with our legal by looking at the invoices. Looks like the Sui Brothers thing is continuing to be whack-a-mole. So,
yep, we just got a response. I'll forward that to members, and we have our replying to their response to our motion to dismiss with that 2 weeks, so.
Okay, well, keep us posted and how it's going. Any other discussion? All those in favor say aye. Aye. Opposed, that carries. Next we review the monthly credit card statements. Anything? I did just have a question because I was wondering, I saw that we are doing a little bit of hotel, some Instacart and some Uber. Is that, is that like support for participants or what are those transactions for?
Yes, so those are for our infectious disease prevention team. So we have a couple of TB cases and that need support for housing and for food. And these are people who cannot afford it otherwise, so we just decided to do that. And they have Instacart that they can, I think it's $125 a week.
Okay.
So for their food. But once they tested consecutively 3 times negative, so they'll be out, and so that's the goal. But those are big expenses.
Great, I haven't seen expenses like that since the pandemic, so I was like, okay. And then the other thing was just play project, there's a $1,200 approximately. Is that for like a play structure for the lobby?
What is it
It
called?
says play project, it's $11.85.
So I think we use, we bought some of the play, I don't know, like toy for kids in the lobby
Yeah.
when parents come, so kids can play. I'm thinking that's for that.
That's it. Okay, thank you. Any other questions? Entertain a motion, put the credit card statement on file. So moved. Second. All those in favor say aye. Aye. Opposed, that carries. Next is approval of check request payable to Main Street Construction for generator fencing. I'd entertain a motion. So moved. Second. And I remember this coming to us before, and now we're approving the check. Any questions? All those in favor say aye. 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 Opposed, that carries. Let's not have e-bikes leaning against
Yes.
the generator anymore and fritzing it out.
Or people sleeping against it.
Yeah, that too. Yeah, well, that's why we opened the shelter. Next we have approval of, wait, did I ask for, all those in favor? I'm sorry, on the generator. Okay, all those in favor of approval of the check request payable to Main Street Construction for generator fencing, say aye. 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 Opposed? That carries. Next we have approval of Credible Mind Amendment 1 to license agreement. Is that entertain a motion? So moved. Okay. And I would second it. Can you just have some background on what happened?
Credible Mind Project.
Looks like we're extending it from
Yeah.
26 through 27.
Oh, so it is.
So, you know what Credible Mind is?
No, it no.
Oh, that's the mental health, how would you describe it? Mental health software. It's like anybody in the entire community can go on there and use it. It's free, and you gotta get on there and look at that thing. It's.
Because, you know, everyone's using AI as their mental health, for mental health. There's, people are using AI and there's
It's
quite.
not working out, I've heard
No,
that.
no, it's very dangerous
It is.
actually, and Illinois has passed rules around the usage of AI for mental health provisions, so
Yeah,
if we have a different alternative, it would be good for us to promote it. Just because we're seeing a significant increase in the use of AI, or.
it might be good, to send out another press release about it, let people know about it.
Okay. Yeah, it would be, I'd like to know more about how people would access it, because we're paying about $4,500 a year. Any other discussion? All those in favor say aye. 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 Opposed? It carries. Next, we have approval of radio advertising package with Illinois Soul for January 15th of this year to January 18th of next year. Could I entertain a motion?
So moved.
Second, just making sure I understand the full quote.
The good thing about Illinois Soul is that we can do different Right now, we're doing HIV stuff, but it can be anything. You can give them different stuff every single time, they don't care.
And then I just wanted to mention that their targeted population is one of our priority in our strategic plan. So the goal is to make sure that and it's difficult to reach those population in any other way. So I think that's the main goal, to make sure that people who listen to those radio know our services and can access our services too.
No questions. Okay, all those in favor say aye. Aye. Opposed, that carries. Next, we have approval of Service 51 quotes for PrEP digital campaign and HIV prevention digital campaign. I'd entertain a motion.
So moved.
A motion, and I will second it. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of service proposal and agreement from D1 Networks LLC for a security system for the refugee center. I would entertain a motion.
So moved.
A second. It seems like there's a note from Jim about this, working on a grant for their operations.
Right, they're gonna work on, they're applying for a grant. And to have that grant, they have to be secure. So we've already started installing the doors, and what this is gonna be is any entrance into the refugee center, they'll have to be buzzed in
Good.
this equipment.
That's a good idea right now. I'm sorry, you said grade in here, so
Oh,
that's
no,
why I was
yeah,
getting confused, so I was
right.
like, they're working on a grade for their operations
Okay.
grant.
Yeah.
Got it. That's helpful to them.
And then I just wanted to add that the idea, since they don't have the grant yet, the idea is to do a month-to-month bill that, so that we can, on top of their rent.
I see.
So,
Got it. So you'll be adding into their rent
yeah,
instead of all at once.
yeah.
That makes sense. And then, because it's about 13.5. All those in favor?
Aye.
Aye. Opposed, that carries. Next is approval of quote from Imperial Service for additional cameras. I'd entertain a motion.
So moved.
Got a motion, and I will second it. Looks like we have some blind spots. Is Imperial Service, our present system was?
Yes.
Okay.
Mhm.
Okay. Yeah, it's about 10 grand. That makes a lot of sense. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of revised personnel policies. In Omnibus, it's 9500 1.1 hiring policy, recruitment and selection process, and 9500 6.6 Victims Economic Security and Safety Act. Entertain a motion, and then I'll ask for an update in staff.
So moved.
Motion, I'll second it. Could we get an update on the purpose? I saw things that were highlighted that had changed. Just wanted some background.
The hiring policy was changed because our process has changed a little bit. And we just are reviewing those continuously and making changes as necessary. The Victims Economic, I call it VESA, I'm not sure exactly how, the state law has changed. So we changed the policy to match it.
Okay. Were the requests coming from the union at all in terms of the hiring policy?
No.
No? I think, I just want to speak, hiring is a really key part of equity. Like how you do hiring, it's very absolutely determines to a large degree equitable processes. So I think it's important that all the positions are emailed to staff, so I really think that's a great idea. And that they are required to be posted for a minimum of 10 work days. Also a really great idea. I like at least 14 days, but I'll settle for 10. And then applications considered until final selection made also remains open. And then also any internal candidates meeting minimum qualifications will be offered an interview. I think all of those are really good steps towards, I think, I will say the word equity, but that's, I would say best practices in getting really qualified candidates and I'm glad that we took the word verbal out of offer of employment. I think that's professional, so glad to see it. I thought it was a good set of changes.
Danielle, I need to back up a little bit. You asked me about if that was any of the union recommendations, and the first two were as part of our collective bargaining agreement.
Got it.
So just for clarification, those did come through the
Okay.
collective bargaining.
I mean, it looked like it might have, which is
Yeah.
why I asked,
Yeah.
but
Sorry about that, I wasn't sure.
that's fine, no problem.
I just want to thank you for finding ways that we can also, work towards retaining good staff too, because if they see a path forward by posting the jobs, considering having if you meet minimum requirements, you get an interview. Thank you, that's good, that'll help. And then the other changes, we had to make those at the county with new change state law.
Okay,
Yeah.
Great. I think I have a motion and a second on the table. All those in favor say aye.
Aye.
Opposed, that carries. Then we have a pending grants contracts with the administrator to sign. Oh, none, okay. And then, so I would entertain a motion to go into closed session.
Do I have to read
I
the
think
whole
you
thing?
have
Yeah.
to read it.
I move that we go into closed
I
session.
punted to you.
I
Did you
know,
see
we're
that?
great, that's good, that's fine, I talk fast. I move that we go into closed session pursuant to Open Meetings Act 5 ILCS 120/2C1 to discuss the appointment, employment, compensation, discipline, performance, or dismissal of specific employees of the public body or legal counsel for the public body, including hearing testimony on a complaint lodged against an employee of the public body or against legal counsel for the public body to determine its validity. We move that who stays, who do we want to stick around?
First, you made your motion, do you want to see if there's a second?
Is there a second?
I second the motion.
Okay.
I guess you would ask for all in favor then, or further
Usually,
discussion?
yeah, I'm just thinking the way that, in my other body, the motion includes who we think
Oh.
should stay and who should.
Do you want to put in discussion who you think, as part of this discussion before it's voted on, who you think should stay based
Yeah.
on?
I move that legal counsel Ruth Wyman should stay. Are we keeping Julie,
I-
a recording secretary and then?
That's up to you guys.
Yes,
I-
Recording
I
secretary.
would suggest
Yeah,
recording
the recording
secretary and
secretary.
Julie,
Okay.
we can always kick you out if we need to.
Yep. That'll be it.
Right, all in favor?
So
I think
we
we
have a
have roll call.
motion and a second, I would ask for a roll call, please.
Danielle Chenoweth.
Yes.
Jennifer Lund.
Yes.
Great, we are
Staffer in the blocks.
going to move, yeah.
Oh,
It took me a second.
Eat the food outside your office, right?
That's right. You can go home.